Patients are vulnerable, and if they deteriorate because of lack of staffing, then we as a profession have failed.
You just really cannot give the best care and the best standards when staffing levels are inadequate.
It's a professional, dedicated role that we do, and we just want to be able to do that efficiently and effectively.
I used to say, and it is blunt, that without this piece of legislation, people will die.
It's easy to dismiss a fellow politician making those arguments, but it's much harder to do that when you have somebody who's come to the Assembly after they've just finished their shift in work and have been looking after patients all day.
Whatever the RCN does to benefit nurses and patients then goes across everybody, so everybody benefits from what we do.
We were going to do it on the basis of cross-party working, reaching out to members across the Assembly and presenting them with what I thought was the strong and compelling evidence about why this was the right thing to do.
That is a different way of doing politics. It's a different way of doing things here in Wales.
It's so important to have the right staff at the right place, at the right time, to deliver safe patients' care.
Safe staffing is the top concern of nurses, and it's always been the top concern of nurses, certainly ever since I started at the Royal College of Nursing in Wales in 2004. If there isn't enough nurses on the ward, they can't deliver the best care, they become demoralised, and they see that the patients are suffering. And that will demoralise a nurse faster than anything else, realising that they're not delivering the best care.
In reality, inadequate staffing levels means that patients can't get what they need at the right time or when they actually need it.
And there's the impact on staff as well, staff working longer hours and stress because they are not able to do the job that they've come into nursing to do. Staff do get worried and upset if they haven't been able to carry out all the tasks and the care that is needed.
We were, as a college, having regular reports of poor standards of care in parts of the UK, and the college had done some work on ratios, and Lisa Turnbull and I were sitting discussing this in my office about how could you realistically implement ratios in wards where you really had no jurisdiction, because it was down to individual trusts in England and trusts and health boards in Wales. And then Lisa said to me, yeah, but it would be easy if it was in legislation. And I said, if what was in legislation? She said, well, you could campaign for legislation. And I just looked at her and I thought, could you really campaign for legislation?
So why wasn't the NHS employing enough nurses? What we found out was that the way the system worked in Wales was that the NHS hospital trusts looked at how many nurses that they could afford, and they told the Welsh Government that, and the Welsh Government essentially commissioned that number of student nurses. So the number was based entirely on what they could afford. And we argued that there needed to be better workforce planning, that they should look at what they needed to deliver safe care, what they could afford, and try and make those meet in the middle.
One evening I had to take my mother-in-law to a hospital, to an emergency assessment unit, and I watched that evening how more and more patients kept coming through the door and watched the staff struggle to cope with that scenario. And I asked the nurse what time she was going to finish her shift, and she smiled and she said that her shift had finished hours before. And I asked her, why are you here? And she said, well, you've seen what it's like tonight. How could I possibly leave the patients and leave my colleagues to deal with that? And I just thought we need to do something about that. We need to ensure that our nurses are working in conditions that allows them to do the job that they were trained for, and to allow the patients to have the benefit of those nurses being able to do the job they were trained for. And if we were asking them to look after too many patients, then that was bad news for patients and bad news for the nurses, and I wanted to do something positive to try and address that situation.
Then I had conversations with Kirsty around what she had experienced and what needed to happen.
We decided that the only way to ensure safe staffing for patient care was to call for a new law. And that's what we decided to do. And we decided to set out to persuade all of the political parties and the government that this approach could really guarantee some safer care for patients in our hospitals.
Well, it came to the board just to say that we wanted to start this campaign and that we wanted to involve as many members as we could.
And we started to talk at that point then about what was causing issues for our members, what was causing them the most anxiety. We had high levels of sickness amongst nurses and staff, and how their morale was. And when we did then a survey of that, it came out that it was the pressures that they were under in their workplaces, particularly on the wards, that led to their morale being so low. So we knew that we had to kind of start to use a strategy of politically pushing the government into a position of accepting the pressures that nurses were under at that time, and really engaging, I think, with them to get them to realise that the way forward was potentially looking at a staffing bill.
First thing we needed to do was really make sure we'd explain to all of the politicians here about the link between the number of nurses and the skills and qualifications that nursing staff had and good care. So we needed to demonstrate that link in terms of hard scientific evidence, and we also needed to demonstrate that link in terms of actual frontline experience.
We'll move now then to item 2, which is an evidence session on the Safe Nurse Staffing Bill.
And that was where we were very fortunate. We had some very good academics, Professor Rafferty, Linda Aiken, who were able to share their research in educational seminars with Assembly members and really demonstrate that the weight of scientific evidence was there.
Could I ask Professor Rafferty to further outline the findings of the RN forecast project relating to nurse staffing levels and mortality areas?
So I think we have a very clear and consistent finding of a positive association between poor staffing levels and patient outcomes over a period of time and across different geographies.
If poor nurse staffing means that your mortality rate rises by up to 26%, that's shocking.
And what we are saying, in fact, is that unless we do something to improve our ratios, there will be an increased mortality rate.
If you know that there is a threat to public safety, you have to take action, and that was the case we were building. Ideas for law can come from the government, or they can be put forward by committees. But now and again in this place, they allow the backbenchers, people who are not part of the government, Assembly members, to put forward their own ideas, literally into a ballot, and their name is drawn out, and if their name is drawn out, they have an opportunity to put forward a proposal for a law.
I submitted my name and submitted a proposal to introduce safe nurse staffing levels in the Welsh NHS. And I was surprised as anybody that my name was drawn out of the hat. It's kind of like politics' version of winning the lottery. So I had the chance, therefore, to bring forward my idea to the floor of the Chamber of the National Assembly for Wales and ask fellow Assembly members to support that piece of legislation. I was a member of the smallest political party. I didn't have swathes of colleagues that were going to be able to push this through. We were going to do it on the basis of cross-party working, reaching out to members across the Assembly and presenting them with what I thought was the strong and compelling evidence about why this was the right thing to do.
If I was being completely frank about it, I suppose the first time I heard that Kirsty Williams had won the ballot, my heart sank. And that's really just because if you're the health minister in the Welsh Government, you are very busy indeed. We already had a significant legislative programme that I had to take through on the health side, and here was going to be another major legislative issue. So in that initial moment, I suppose my first reaction was, oh no, here's another hot potato, here's another big piece of work coming my way. But once you get drawn into the subject matter itself, then of course your interest gets drawn in and you begin to think much more about what are the policy objectives here and to what extent is the government able to support them.
We were coming forward to suggest this bill just at the time when budgets were beginning to become really, really tight. And the first question from any responsible Assembly member, and particularly from the ministers, was going to be, is this going to cost us more money and do we know it really works?
Well, there's a series of stages and hoops that you have to jump through, but I thought the longer we could keep the legislation alive, the harder it would be for the government and the minister to be able to knock it back at a later stage.
Well, the political situation was quite interesting. We had 30 Labour Assembly members, we had 14 Conservative Assembly members, 11 Plaid Cymru and 5 Liberal Democrats. Now, of course, Kirsty's party were going to support Kirsty, so we had the 5 votes. But you can see from the arithmetic that we had a difficult situation. We needed to persuade the largest party, the Labour Party, to support the bill, and we also really needed the support of Plaid Cymru and the Conservatives. And of course, we wanted everybody's support because we genuinely thought this was a really good idea. So we had to work quite hard to try and persuade all of the political parties to support this bill.
We had the first vote that accepted the principle and allowed us to move that process forward.
My first worry, I think, was about the quality of the evidence base, because the proposition here is that if you have safe staff levels, whatever that might be, on a ward, then outcomes for patients are better. And I wanted to be sure that the evidence for that was firm, and I wanted to be sure that the costs of it all had been properly accounted for.
What Mark said was, I'm not convinced, but it's interesting. Why don't we hear some more of the arguments? Why don't we hear some more of the evidence? I cannot emphasise to you how remarkable it is for a politician in this day and age to be quite honest about the fact that, I don't know. Let's listen to the evidence. Let's consider the evidence. Let's weigh it up. Maybe it is a good idea.
I'd be the first to admit that some of the things that I'd thought about maybe would have had unintended consequences. So it was an opportunity to work not just with the health minister and other political parties, but was an opportunity to work with those out in the field to make the legislation as good as it could be.
When I first listened, I listened to the debate from the chamber, and the then Minister for Health gave a series of questions he felt needed answering before his government were prepared perhaps to support the bill. And based on those particular questions, we had a look at the environment in which we were going to operate in. So could we answer those questions, and what was the environment like that we were going to operate in? So where were the friends, where were the enemies, and what were our challenges?
I hadn't given due consideration to the acuity of patients on a ward. I've been thinking about it in bold numbers. Well, of course, what safe nurse staffing level looks like today might not be safe tomorrow if the acuity of your patients had changed. So the whole process gave me an opportunity, as well as other people, to reflect, to make sure that we got the legislation right. Luckily for me, Mark's focus was very much on what can you do to address my concerns, and let's see how far we can get together, rather than starting from a basis of, forget it, I'm not really interested and I'm going to continue to put hurdles in your way.
So what happened now was the bill was remitted to the Health and Social Care Committee that had a detailed investigation now into the idea and the concept and the content of the bill. So you had evidence then being given to the Health Committee from all sorts of stakeholders, the BMA, nurse directors, obviously the Royal College of Nursing, ourselves, and all of the Assembly members on the Health Committee who come from all of the political parties. David Rees was the chair of that committee, then examined whether or not this bill was a suitable bill to proceed to a law.
There were 2 points being expressed. One was the title, because there was initially a safe nursing levels, and there was deep concern as to the word, what does safe actually mean? But the second one was the unintended consequences of passing a bill like this, which would require particular levels of nursing on one ward, but not require that on other wards. And could the consequences be that in difficult times, health boards will transfer staff from a ward which isn't in that area, which doesn't have the legal requirement, to a ward which does. So again, would the patients on other wards suffer as a consequence of people being transferred to meet the legal requirements?
I kept hearing the unintended consequences everywhere I went to was, yeah, but if you introduce that, the unintended consequences would be for you wouldn't have enough physios or you wouldn't have enough occupational therapists. And that's an important point because you're looking at safety of patients. I pointed out, as did a lot of our members, that the point of contact with nurses is 24/7. And when a patient comes into an A&E unit, it's the nurse that meets them. When a patient's admitted to the ward, it's the nurse that meets them. When a patient goes out to community, it's the nurse. And if you don't have that nurse doing that initial clinical assessment, you won't get a referral on to any other healthcare practitioner. Realistically, patient safety is about getting the diagnosis right in the initial assessment process.
I think there was a real element of nervousness and apprehension in the way that Assembly members approached this. Many of them many of the conversations I had with Assembly members revolved around, when is a law appropriate? Should it not be policy? What's the difference between a law and policy? Some real constitutional issues that people were turning over in their minds. Is this suitable for legislation? So we really had to make those arguments convincingly.
There were Assembly members who thought that it was a good idea in principle, but an actual proper act wasn't the right way to go about doing it, so they wanted regulations or a softer approach, which wouldn't really have worked because there was already guidance there that was being ignored. Legislation was what was needed. So I went with Tina to a meeting with a member of the Health Committee at the time who was actively against the bill. It was just coming up to the 2015 general election, so Assembly members were going out campaigning, and I remember we mentioned to this in particular Assembly member that people would be shocked when he's going out knocking on the doorsteps to realise that there isn't legislation that says that you need a certain amount of nurses on the ward, and that it was like a penny dropped. So he sort of realised that, oh, this is something that maybe we should get behind. So Tina then brought it home and brought him on side.
When you look at it, I guess it's down for nursing staff to become political. If you really know what you mean about patients and getting things right, then you've got to have the strength of character to challenge perceptions, because if you don't, then you take on that accountability when things fail.
And I remember being in a meeting organised and supported by the RCN where nurses from the front line came to the Assembly and talked about why they felt this would make a difference on their wards.
It was a case of how could I make this like a light bulb moment for them. And I just took them through part of my shift from when I came on, had a report, and then what I did with patients. But I also took them through, well, the buzzer is going and I can't get to that patient because I'm with this patient, but the buzzer's going and this patient needs painkillers and I can't get to them, and I can go to another patient, but the buzzer's still going for another patient. And I sort of took them through a brief overview of a tiny, tiny part of my shift. And I think that seemed to give them an insight into the reality of what not having enough staff nurses and nurses on the shop floor means.
I just spoke, like I always do, as a nurse from the heart. I chose this career for a reason, because I want to give something back. I've seen members of my family receive care from the NHS. At times I've received it from the NHS, and you just want to give back to the NHS. You want to give something back to society. It's a professional, dedicated role that we do, and we just want to be able to do that efficiently and effectively.
And the AMs that were there weren't 100% convinced that it was good, soon changed over and supported the bill, so it was really excellent.
I've been told that, and if that's the case, I mean, that's amazing, but I was just the person that was there at that time, just saying the reality of all the nurses across Wales. And I think nurse anywhere would have sort of been saying the same thing.
That was a real turning point in the campaign when Assembly members were able to hear directly from nurses in charge of wards in Welsh hospitals that said, this will make a difference to my patients and it will make a difference to my colleagues. And you know, it's easy to dismiss a fellow politician making those arguments, but it's much harder to do that when you have somebody who's come to the Assembly after they've just finished their shift in work and have been looking after patients all day.
It is always evidence from the people who are doing the job that is the most compelling. So I'm not in the least surprised that committees found voices from the front line the most persuasive. And the RCN, which has long invested in preparing their members for the interface between the world they work in and the world of politics, would, I'm sure, have made sure that their witnesses were ready to do the job they wanted them to do.
And then we decided that, you know, we needed to go on the streets and meet them. So we came up with the good old sandwich board and let's get out and meet them. And let's give a little piece of paper to the guys that were going around, a little message, get them to sign it and post it back to us or post it to their AMs and engage with the public and get feedback. And the feedback was positive.
Once the campaign started and people started to get to know about it, patients were asking about it and families, and they were saying that they wanted to get involved and what could they do.
My role was to engage with the public on a daily basis as much as possible. On my days off, go in, run stores, campaigns, do walks around the ward, hand out leaflets, collect the leaflets and cards, get them back, deliver them to TMI for the full-time officers and people like the RCN director in Wales and the full-time staff to take those to the Assembly and have the meetings with the politicians.
Every opportunity we had, we just talked about it, and I'm in a fortunate position, not only as chairs of the Welsh Board, but as a practicing A&E nurse, that I can talk about the difficulties that staff have out there and the fact that what they want to do is deliver the best possible care and in a good environment.
They realised that this is a piece of legislation that everybody wants, but there wasn't an evidence base from the public to show that. So Tina and others decided that the best way to do that would be with a petition, and I was tasked then with coming up with the wording, finding a member who would support the petition, which I did with Richard Jones, and getting it on the Assembly website and promoting it with the public.
Once we had the petition up and running, I actually used Facebook. I put this on Facebook to all my friends, encouraging them to put it to all their friends. And I have to say it was very successful.
We got just over 1,600 signatures, which meant that it went to the petitions committee, and it also then was mentioned as part of the debate when the bill was introduced to the Assembly as well. So it showed Assembly members that there was actually public support for this type of legislation.
This in itself actually made AM sit up and think.
So eventually the committee did of course conclude, and they came to their report, and they did say, we've got everyone's agreement from across party that this was a good idea for a law, that it was a sensible idea, that the weight of the evidence showed that it would benefit patient care and it should proceed. They did make a number of suggestions for how it could be improved, that the wording and the text of it could be improved, which is as to be expected. So then, after the committee report, that goes back to the main Assembly, and all 60 Assembly members have to vote again. So one more time we were in the position of trying to get every political party to sign up to say the bill could now go from stage 2 to stage 3. So the argument that we should have a law, I think, had been made at this point. But what would the law look like? What would it contain? That's where some of the arguments started to happen. Some of the Assembly members wanted to be really ambitious and have the law that talked about safe nursing care everywhere. And obviously, as the Royal College of Nursing, that's what we wanted. The government, though, would not want to support that because they were very clear, we can only do what the evidence says. The evidence is only in this area. The government said that they could not support a bill with the word safe in it. They talked about other words, appropriate, sensitive nursing care, but could not support the use of the word safe.
You know, we could have held out for stuff and argued about the minutiae to get it perfect, or in the way I perceived it to be perfect. But in the end, you can't let perfect be the enemy of the good, and you have to work together in politics and focus on what you can agree on and try where you need to compromise.
So the Royal College of Nursing took the decision that we were still going to support this bill, even though there was a government amendment to remove the word safe. When a bill is passed in the Assembly, it needs something called a financial resolution. A financial resolution essentially says that if you pass this bill, it won't bankrupt the country, but we can afford it.
I didn't feel that I was in a position to lay a financial resolution in the normal way because I didn't think that the financial implications of the bill were entirely worked out.
So we started doing an analysis of what it would cost, and I was told that 95% of the staffing principles that the CNO had issued in 2012 were being adhered to. So then I looked at the cost of the 5% that was unmet, and then we did freedom of information, and we wrote to the health boards asking what their agency expenditure was. And then we did the calculations on the cost of the agency expenditure based on if you were to recruit the right numbers of staff. And we did a cost-benefit analysis, and when we were asked where the costs would go, we're saying you'd be actually saving money if you got your staffing levels right.
Crucial was looking at the amount of money that the health boards were spending on agency nursing, and I think it was actually a shock to them when it was all aggregated, and possibly a shock to the Minister too. And that, of course, helped us make the case, because once you've got safe staffing, legal staffing levels in place, then you've got the incentive to recruit permanent staff to keep those levels up.
There's nothing more serious than the care of people that you love in a hospital environment when they're really vulnerable. And we really had to make that case quite forcibly to the Assembly members. And that, again, our members did that. We brought members in to meet with the AMs to tell them how important this was, that this was not an appropriate topic for political game playing. This was something that they had to support.
Without that extra pressure that the financial resolution brings to get things right, you can have a bit of drift, and you could even have a bit of complacency. You know, well, it doesn't really matter if the figures are right because the bill is going to go through anyway. The financial resolution, quite rightly, makes sure that that can't happen, and I thought it worked very well in this case.
And so with all of that very serious political campaigning and pressure, the government did put the financial resolution down in November. And at that point, we were over the biggest hurdle.
I was very fortunate that there was a spirit of cooperation to make this work. So people could have made things more difficult, but there was a genuine desire not to use this kind of quite technical part of the process as an opportunity to kill it off. It could have been done, but people were in a better place than that, thank goodness.
I want to pay tribute to the member in charge for her perseverance and patience, and for that of the Royal College of Nursing, whose Time to Care campaign was the genesis of the legislation before us today.
In the end, everybody agrees that they are going to pass this bill.
I would like to thank nurses past and present who have been instrumental in getting the bill to this stage, and I am grateful for their witness and their testimony in how important the legislation is before us today.
huge relief. So that was stage 3, and that was the most difficult. And then we all needed stage 4. We needed one more vote where everybody in the Assembly votes on the bill as is.
If colleagues in this chamber today decide to do so, it will mean that Wales will become the first country in Europe to pass a law that ensures that nurses in the first instance on acute inpatients wards will have the time to deliver safe, effective and quality nursing care.
On all sides of this House, there's agreement in respect of this bill that we need a piece of legislation which requires guidance to be issued to Welsh health boards and other NHS bodies in Wales on the staffing requirements in terms of nursing.
I hope members here and members of the public will agree that there are politicians mature enough to recognise that other parties have good ideas too, and that we can support them. And I'm proud, on behalf of my party, Plaid Cymru, to support Kirsty Williams.
And by that point, everyone was like, yes, 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 we're happy with this. Everyone supported it. I think it took something like 10 minutes, the last final debate.
There was very clear evidence presented to the committee which looked at this legislation, which suggested that when more nurses are available to care for staff, there are better patient outcomes, and that's what this is all about.
I will close with a quote from Tilda Shaloff. Actually, she is a Canadian ICU nurse. The hospital will never be healthy for patients if it is not a healthy environment for nurses, where their voices are heard, where they can care for their patients and use the full extent of their knowledge, abilities and skills. This bill will give nurses the time to do just that, and I commend it to the Chamber.
So, 10 years probably of campaigning and arguing, 3 concentrated years of very, very, very hard work, and 10 minutes in the last stage 4 debate, and it was passed.
The proposal is to agree the motion. Does any member object? The motion is therefore agreed in accordance with Standing Order 12.36.
So this is it. This is the Act, and it's been a fantastic process to be a part of. We are a small nation, but a nation with big ambitions.
Sometimes I felt it was like pushing a huge wooden tree trunk up a mountain, you know, because you'd have to have a lot of people behind you and it was a heavy weight, but yeah, the members delivered.
I think it's so exciting, not just for the Royal College of Nursing in Wales, but for Welsh people generally.
We're the first of the 4 countries of the UK to do it, but I understand we're first in Europe as well to do it. So I think other people are watching us at the moment.
We've had interest from Canada. There are parts of Europe, and you know, people are monitoring what we do.
One of the very positive aspects of the Act is that there should be provision of a Welsh language service to those patients in need. Felly, os yw claf eisiau siarad efo nyrs Cymraeg, mae hynny'n gwneud cyfathrebu yn lot hawsach.
Well, the evidence base is that it will reduce mortality rates by nearly 26%. Because where you fail to have the right numbers of nurses, it was shown in the evidence base that up to 26% of patients die prematurely. That's huge.
People want it everywhere. They don't want it just in the medicine and surgery. They want to know when we can roll it out into all areas. Community hospitals, A&E, mental health, community nursing, everybody wants it.
Currently the ward I'm working on actually doesn't come under the Act because it's classed as subacute, but the hope and the plan is that all patients everywhere will come under the Safe Staffing Act in Wales, and hopefully the UK as well.
But it's like everything, isn't it? You have to crawl, you have to walk before you can run. So we're quite a bit of a way off of getting it rolled out everywhere else. But we'll get there. At some time we'll get there.
The legislation has been framed in such a way that it can be expanded so that more nurses doing different types of work can be included as the evidence base grows, so that we can use that evidence then to inform our staffing levels in different settings.
So we have 6 work streams actively engaged in this process at this time. We have mental health, paediatrics, health visiting, district nursing, care home and adult medical and surgical inpatient areas. So each of these work streams has a responsibility to develop, test an evidence-based workforce planning tool. So once they have been able to demonstrate and provide assurance that they have that robust evidence-based workforce planning tool, then Welsh Government may well consider extending the Act to one of those areas.
When you're trained to be a nurse, you're trained to deliver really good care. And sometimes, because you haven't got enough staff on, you can't do that. So you go home, you don't feel so good. And I'd like to think that at the end of all of this, nurses go home supported and they feel they've done a good job that day.
We're not always able to reward people with the money that we'd like to in an age of austerity. We certainly need to get the message to them about how much they are valued and how much the work they do is understood and appreciated.
I think the nurse staffing levels gives me hope, and I think it's going to expand the number of nurses in Wales. It's going to give the opportunity for more people to be a nurse. It's also going to retain nurses and give those patients the exemplary care we know that they deserve.
I think this campaign has really showcased the Royal College of Nursing at its best. It came out of the frontline experience of our members. We then used the professional expertise to look for the scientific evidence, examples of legislation that's been done in other countries, examples of how it could be done to show that it was necessary. So utilising the experts, bringing in that kind of evidence was critical, and we can only do that because we are a professional body.
It shows that they are the voice of nursing in Wales, that they will stand up for patients and nurses in Wales. Because we're not just about the nurses, we're about the patients as well. The nurses are the voice of the patients, and if we haven't got a strong voice at the top, then patients haven't got a voice.
I'm immensely proud of the achievements of the Royal College of Nursing in this campaign, and thank you of course to Kirsty Williams. But the RCN has been, I believe, very influential, and the power of influencing when it comes to policy and politics and healthcare is remarkable. And as a nursing workforce, we're all very grateful to the Royal College of Nursing for those efforts, and in particular as well to our Director of Nursing in Wales in the RCN, Tina Donnelly.
She understood how government worked. She brought all of that to the lobbying role that the RCN was playing in this case. And in that sense, she had a pragmatic approach to it all, as well as being fiercely attached to the principle that the RCN was trying to promote here.
Without Tina as our leader giving clear direction, I don't think this would have actually got as far as it did anyway, to get us into the place, to get access to the politicians. And I think all the groundwork that her and the team did is absolutely amazing.
She was relentless, absolutely relentless in pursuit of the goals of the legislation.
She had with her a whole team of other people who were working on the detail of it all, and they were very important too. I think that without Lisa, for example, Lisa Turnbull, the bill wouldn't be the bill that it was, because while Tina was doing the front of stage stuff, Lisa was absolutely immersed in the detail of it all. And we were very lucky indeed, both with Tina, but also with Lisa and the other team of people that the RCN were able to mobilise.
This is a campaign that has demonstrated that when you get members, professional and the public working together, anything's possible. So the membership know what they've achieved. We know as a group what we have achieved. The big success is that everybody thinks that it's their act, and that's the beauty of it. It doesn't belong to anybody, it belongs to the patients, the public and Wales, and we should be proud of it.